This video was a health talk on hypertension I gave at the Jubilee Baptist Church in Agege, Accra during their 20th anniversary celebration. High blood pressure is a serious medical condition that significantly increases the risk of heart, brain, kidney, and other diseases. Hypertension is a major cause of premature death worldwide, and it's one of the global targets for non-communicable disease to be reduced by 33% between 2010 and 2030. 1 in 5 adults with high blood pressure have it under control, but an estimated 1.8 billion adults between the ages of 30 and 79 have hypertension, and they are people living in low and middle income countries. Blood pressure is the normal pressure or force produced by the circulating blood pumped from the heart against the walls of the body's major blood vessels. It is written in two numbers, that is, the top value being the systolic and the bottom being the diastolic. Therefore, high blood pressure is the increased pressure produced by the blood in the arteries. It is diagnosed when it is measured at least 5 different times with the systolic reading greater than or less than 140 millimeters of mercury and the diastolic reading greater than or equal to 90 millimeters of mercury. It is important to note that the best place for high blood pressure to be diagnosed is in a health facility by a professional or a licensed health worker. Now let's talk about the risk factors. We have modifiable and non-modifiable risk factors. Modifiable risk factors include having an unhealthy diet, such as excessive salt intake, diets high in fat, diets low in fruits and vegetables, physical inactivity, intake of alcohol and tobacco, and being overweight. The non-modifiable factors are having a family history of hypertension, aging, that is age above 65 years. But it is also interesting to note that young people between the ages of 20 or 20 years and above are at risk of having high blood pressure because of our lifestyle choices. And one of the non-modifiable factors are also existing diseases such as diabetes mellitus, or kidney diseases. Symptoms of high blood pressure. High blood pressure is usually called the silent killer because most people with high blood pressure are unaware because it has no warning signs. That is why it is important that one measures his or her blood pressure regularly. After the age of 30, it is important to check your blood pressure at least once a month. Now let's go to some of the symptoms of high blood pressure. 1. Headache, which is usually pounding in nature. Nosebleed, palpitation, excessive sweating, vision changes, buzzing in the ear. Some of the severe symptoms include fatigue, nausea, vomiting, confusion, anxiety, chest pain, shortness of breath, muscle tremors, lightheadedness or fainting, and sometimes blood spots in the eye. Usually, patients with diabetic mellitus have these symptoms. As I said earlier, a large number of people with high blood pressure are unaware of the condition. So some of the complications of uncontrolled blood pressure includes chest pain or angina, heart attack, which is basically reduced blood supply to the heart muscles, resulting in lower oxygen sent to the heart muscles. Heart failure, that is, the heart can't pump enough blood and oxygen to other vital bodily organs. Then we have irregular heartbeats, which can lead to sudden death. Another complication of high blood pressure is cerebrovascular accident, also known as CVA or stroke. There are two types of stroke. One is ischemic stroke, which is caused by a blockage in the blood vessel. And the other is hemorrhagic stroke, which simply means the bursting or the rupturing of a blood vessel. Both types of stroke affect the brain cells, depriving it of oxygen and blood, and subsequently the brain cells die. When the brain cells die, that part of the brain which dies affects that part of the body it controls. Some of the symptoms of stroke are you have paralysis of the arms and the legs. You can have a partial paralysis or a total paralysis. The partial paralysis can be one side of the body be malfunctioning. So you get one left arm and one left leg malfunction, or you can have both arms malfunctioning or both lower limbs malfunctioning. The patient can also have slurred speech or no speech at all, can have loss of memory. And so these are some of the few symptoms of stroke. Now let's talk about prevention of high blood pressure. One, we can prevent high blood pressure by reducing our salt intake, eating more fruits and vegetables, being physically active on a regular basis, avoiding the use of tobacco, reducing alcohol consumption, and limiting intake of fats in our meals. And how do we manage high blood pressure? One, by reducing and managing stress, regular BP check, then treating of the condition, that is if you have the high blood pressure, then managing other medical condition. Now let's talk about stages of high blood pressure. One, we have the normal stage, which is usually a high blood pressure reading of 120 over 80 millimeters of mercury or less. Then the elevated type is when your blood pressure is more than 120 to 129 being the systolic reading, and the diastolic reading being more than 80 millimeters of mercury. For stage 1 of high blood pressure, you have the systolic reading being between 130 to 139 millimeters of mercury, and the diastolic, which is the bottom reading, being between 80 to 89 millimeters of mercury. With the stage 2, you have your BP reading being at least 140 over 90 millimeters of mercury or more. And the last stage is called the hypertensive crisis, where you have your reading being more than 180 over 120 millimeters of mercury or higher. Now let's consider some fruits and veggies that we can add to our meals. Citrus fruits such as orange, lemon, grapefruit are also good to add to our meals. Consumption of fish, especially salmon, is good because it has omega-3 fats. Beans have potassium, magnesium, and fiber, which is also good. Now, berries All the types of berries are also good: blackberry, strawberry, blueberry, and all the other types. Now, carrots, celery, tomatoes, broccoli, Greek yogurts, chia and flax seeds, beetroots, spinach, garlic, coconut juice, and apple are also good fruits and vegetables to add to our meals to have a healthy diet. I hope you enjoy this video. Give it a thumbs up, subscribe to my channel for more updates on healthy lifestyle and on knowledge about other medical conditions. Press on the bell for notification to get updates anytime I post a new video. Thanks for watching. Bye.